My dad taught me a lot, including how easy it is to forget to cancel things. So I downloaded Experian, my BFF, big financial friend. Experian could help me cancel my unused subscriptions and lower my bills, saving me hundreds a year. Get started with the Experian app today. Your big financial friends here to help you save smarter. Results will vary. Not all bills or subscriptions eligible. Savings not guaranteed. $631 a year. Average savings with 1 plus negotiations and 1 plus cancellations. Paid membership with connected payment account required. See Experian.com for details.
Experian. Rinse knows that greatness takes time, but so does laundry. So Rinse will take your laundry and hand deliver it to your door expertly cleaned. And you can take the time pursuing your passions. Time once spent sorting and waiting, folding and queuing, now spent challenging and innovating and pushing your way to greatness. So pick up the Irish flute or those calligraphy pens or that daunting beef Wellington recipe card and leave the laundry to us. Rinse. It's time to be great.
Today, I want to share some of the hardest patient cases I've seen. It's definitely going to surprise you, but then you're going to be like, oh yeah, that makes sense. The hardest cases I see are not the rare diseases or the emergencies even. They're the kids with chronic, vague symptoms like daily headaches and stomach pain when all the tests are normal and we can't find a diagnosis. Those cases are frustrating for me and so stressful for families. Over the past few years, I've seen a lot of kids with gastrointestinal symptoms that I just couldn't explain. And at first, I thought it was a post-COVID thing, to be honest. Okay, I was just taking care of a 9-year-old. She can't eat anything. She stopped going to school because she feels so sick to her stomach. I, of course, ran every test I could think of, and I still didn't have an answer. So I sent her to a gastroenterologist, and they did an endoscopy and biopsies. And finally, they made a diagnosis. I totally missed it, mostly because I didn't know about it, to be honest. It's really hard to diagnose something you've never heard of. But I swear to you, I really am a pretty good doctor. The diagnosis I'm talking about is relatively new. You've probably heard of things like irritable bowel syndrome or functional abdominal pain. Those were the labels that we have been using. And honestly, those diagnoses really never made sense to me. They don't really explain why the bowel is irritable. And it turns out all of these diagnoses and more are under the same umbrella. They're called disorders of gut-brain interaction. And that doesn't mean it's all in your head. We're going to talk about that. Now we know how and why these symptoms happen. And more importantly, we have ways to treat them. Wait till you hear this. I'm Dr. Wendy Hunter, and I'm the pediatrician next door. I'm that doctor friend you call for practical advice about your kid's health. I mix the science of medicine with the reality of parenting. Let's get to the bottom of this. Is it stress? I've seen a bunch of patients with stomach aches and some with other complaints like joint pain or headaches, and stress does seem to make the symptoms worse. Also, it's easy to blame food for stomach problems. It gets blamed for everything. In fact, I just got an Instagram message from a parent asking me about whether food was causing her child's eczema, but food doesn't seem to be causing any of these issues. The problem is not in the gut, and the brain is fine too. So where is the issue? The problem is the communication between the gut and the brain that's off. Disorders of gut-brain interaction are exactly what they sound like. It's a nervous system problem. It's a nervous system communication issue. And honestly, I don't think anybody ever thought to look there for a cause of disease. That's why I wanted to talk to someone very unique. He's a gastrointestinal psychologist. Dr. Ali Navidi is a licensed clinical psychologist, and he focuses on the gut-brain connection. He helps families understand what's happening between the brain and the gut. It's called the gut-brain axis. But what exactly is that? Dr. Navidi explains it well.
Kind of the classic example that pretty much everyone has seen is if there's something coming up that is really scary or makes us nervous, we feel it in our stomach. Or if we get really surprised and shocked, we can feel our stomach turn. And it's not that we feel our foot turn, it's not that we feel our back turn, but it's because there's this special relationship between the brain and the gut. They love to talk to each other, and they do it all the time. And sometimes, like almost any relationship, that communication can go bad. And when that happens, we often think it's food, or we often think there's something broken in us. But really, it's the way the brain and the gut are communicating that needs to be fixed. We know that we have this central nervous system, and then there's a special little nervous system in the gut called the enteric nervous system. And through the vagus nerve, we have a lot of influence there. And the vagus nerve is that brain-gut connection in essence. And so we see changes in motility, changes in the microbiome. There's a bunch of stuff that can happen based on what the brain is doing that goes through that vagus nerve into the enteric nervous system and makes real physical changes in the gut that are being driven by the central nervous system.
This is the missing link that most parents have never been taught. And I know way too much about this. There is a nerve called the vagus nerve, which tortured me in medical school. And lucky for you, we're not going to trace the vagus nerve's path, and there is not going to be a test. For our purposes here, think about it as a Wi-Fi cable that connects the brain and the gut. It starts in the brainstem, it goes through the neck, past the heart and lungs, and ends in the digestive tract. And it's constantly sending messages back and forth. So when a child is stressed or anxious, that stress signal travels down that nerve and lands in the enteric nervous system, which are the nerves that cover our guts. The stomach responds by slowing down or speeding up. That's why an emotion can cause nausea, constipation, or the opposite when it moves too fast, if you know what I mean. And when that vagus nerve stays active, the gut starts to react even when there's no stress. The signal gets practiced and the pathway gets stronger. So the pain is real, and the source is a chemical message sent from the brain. So what do parents tell me they have tried to help their kids' stomach aches? Parents usually try probiotics and dietary changes, like gluten-free, dairy-free, and so on. And sometimes they go and have a bunch of tests done. Most of the time, in my experience, these things make no difference. Oh, and now, of course, it's popular to talk about the gut microbiome. And Dr. Navidi has the same assessment that I do about these kinds of things to treat stomach symptoms.
There's a lot of research, there's a lot of potential, but I don't think we understand it well enough to reliably help people. I still think it's a little on the fringe. What gets neglected when people focus so much on the microbiome is a much more clear route with much more clear science, which is that brain down. Instead of gut up, brain down to gut. And there's very, very clear things that we can do. And there's a lot, there's like over 40 years of science and showing exactly what works and how to do it.
This is very encouraging, but I want to take a step back because we don't want to go down this treatment path as if we're treating a disorder of gut-brain interaction when a kid actually has celiac disease. Why? Because we will feel like the worst parent ever. How can a parent tell if their child has a GI disease versus a disorder of gut-brain interaction? I was thinking this is a question for Dr. Navidi, but it's actually a question for me, or a gastroenterologist. So how do I know there isn't something else going on? Here's how I think about it as a pediatrician. A disorder of gut-brain interaction is what we call a diagnosis of exclusion. That means we don't have a test for it, and we have to look for things that we wouldn't want to miss first. So I start with, is there inflammation? I look for inflammatory bowel diseases, things like Crohn's disease or ulcerative colitis. We call those IBD. We have good blood and stool tests to look for this. If those tests are normal, that's a really big clue because kids with IBD almost never have completely normal inflammatory markers in their blood. I also think about infection. Some infections can linger and cause ongoing symptoms. So we have to make sure there's nothing like Giardia. Then there's celiac disease. Celiac has very specific blood tests. If a child is eating gluten and those tests are negative, celiac disease is really unlikely. Okay, now let's talk about food. Could food be causing the issue? True food intolerances behave in a very specific way too. They are predictable. The same food causes the same symptoms in a reliable time frame. It's not random. It's not different every week. It's not triggered by different things. When I hear a child reacts to many foods, or that their list of problem foods keeps growing, or that symptoms are worse on school days or before stressful events, that's when my suspicion shifts, because that pattern does not point to food. It points to the nervous system. So when we put all of that together, a kid who is growing normally, has normal lab tests, no signs of inflammation or infection, and symptoms that change with stress or routine, the problem is how the gut and brain are communicating. So that's how I think about this stuff. But what if you're sitting at home right now and you have a kid with some of these symptoms? What should parents look for? Here's Dr. Navidi.
I think there's certain things that can give them a really big clue, right? If their kid has a history of anxiety problems, if there's any history of trauma, if their kid is on the spectrum, or if the kid has current or past problem with eating, so some sort of eating disorder. These are big clues that there's a much higher risk for disorders of gut-brain interaction. And by the way, disorders of gut-brain interaction is this big class of disorders. I think there's for kids, I want to say maybe 20 or so different disorders, including irritable bowel syndrome, functional dyspepsia, different vomiting syndromes, all kinds of things.
A lot of these disorders, when a parent hears them, they really hear that the doctor thinks it's all in their head. That's a phrase I hear a lot, and it's really dismissive, and it's not the truth of what's going on.
I think there's a lot to be said about that statement, but I think the most important thing is all pain is in your head. There is no pain without a brain. So all pain comes from the brain, and it's how the brain is interpreting stimulus from the body. And sometimes that interpretation is really accurate. Let's say we eat some bad Chinese food. There's a lot of stomach pain and nausea. Maybe you throw up, maybe you don't. That's an accurate assessment. There's bad stuff in there and it needs to come out. It's a problem. So that pain and discomfort is completely accurate. However, sometimes that pain is not accurate. In the example of irritable bowel syndrome, they're having pain frequently and it doesn't correspond to any actual danger. So that's an example of the brain perceiving something from the gut, misinterpreting it, and labeling it pain. But it got it wrong. And so what do we do when the brain gets it wrong? We need to help the brain learn that it made a mistake. The problem is there are so few people trained to work with these GI issues. I think a lot of times parents just go out into the community and they don't have a good experience. And then they feel kind of hopeless. With a case like you're describing where they're just not eating, parents are not going to give up in that situation. But let's say it's just more of a chronic pain one. They go out, they see a therapist in the community, it doesn't help. And then they're kind of like, okay, we just need to restrict the food and we need to make sure that they don't go to certain places. They accept these massive limitations in their kids' lives. Sometimes I've seen it where the kid is essentially homebound because of the problem. And they've really just accepted that. And I'll see them 3 years later after they've been at home for 3 years. And I slowly have to pry them out. And it's so hard when they've been at home for so long because they've missed out on so much and they've developed so much secondary anxiety.
This is an incredibly frustrating group of conditions, and I know at this point that it's starting to sound like an endless spiral, but there is a pretty simple treatment, and we're going to talk about that after this quick break. What is one thing I hear all the time as a pediatrician? A lot of kids don't drink enough water. Between school, sports, playtime, and just being busy kids, hydration gets overlooked. That's why I love Cure Kids Mixes. They're formulated with pediatricians and designed for kids. From playtime to bedtime, replacing electrolytes is important for proper hydration, which kids need to create, explore, learn, and be kids. Cure Kids Mixes have no artificial ingredients, no added sugars, and no GMOs, just natural, kid-approved fruit flavors they actually enjoy. And that makes all the difference. Adding Cure to their water is such an easy way to encourage kids to drink more and stay hydrated without the sugar overload. Staying hydrated is not just about water. You also need electrolytes. That's why I recommend Cure Hydration to my patients. It's clean, tastes great, and kids love it. You can grab Cure on Amazon or find a store near you at curehydration.com/Dr. Wendy. That's DRWENDY. Real ingredients, real hydration, ready for the whole family. Every year around this time, people talk about New Year's resolutions. But instead of resolutions, I make a list of my values, and then I build simple rituals that support them. My best friend knows I do this, and this year she said her values are her home and her family, and that means new bedding. She's right. For me, the rooms I spend the most time in and that really shape how I feel are my bed and my bath. That's why this year, my reset started with Cozy Earth sheets and towels. I upgraded to Cozy Earth's Baja bedding set and transformed my bedroom. It's a complete matching set: sheets, duvet cover, quilt, coverlet, with this beautiful, calm design inspired by the Baja California landscape. It feels elevated, but inviting. Then there are Cozy Earth's Luxe bath towels. They're plush, absorbent, and they dry you off quickly. It's a small ritual, but stepping out of the shower and using a towel that feels this good changes how I start my day. When the holidays wind down, I need rest and the feeling that I'm ready to take on the new year. And that's exactly what Cozy Earth delivers: luxury comfort that makes home my best part of life. Plus, it's completely risk-free. Cozy Earth offers a 100-night sleep trial, so you can try it out and return it hassle-free. And everything comes with a 10-year warranty, because once you've experienced this level of comfort, you'll want it to last. Start the new year off right and give your home the luxury it deserves, and make home the best part of life. Head to CozyEarth.com and use my code Dr. Wendy, DRWENDY, for up to 20% off. And if you get a post-purchase survey, be sure to mention you heard about Cozy Earth right here. Refresh your routines with comfort that makes every day feel like a new year.
This episode is brought to you by Peloton. Break through the busiest time of year with the brand new Peloton Cross Training Tread Plus. Powered by Peloton IQ. With real-time guidance and endless ways to move, you can personalize your workouts and train with confidence, helping you reach your goals in less time. Let yourself run, lift, sculpt, push, and go. Explore the new Peloton Cross Training Tread Plus at onepeloton.com.
Before the break, we were talking about something I hear all the time from parents, that they hear a diagnosis like this, and what they actually hear is it's all in their head. When there isn't a clear diagnosis, parents understandably start trying to fix things themselves. Food becomes the most obvious target, and changing the diet does feel like it's the next best step. So I see why parents do this. I asked Dr. Navidi about elimination diets, because this is such a common path families go down. Are elimination diets actually a good idea in kids with disorders of gut-brain interaction?
First off, I think most people don't do them properly. So as an example, there's a well-known one called the FODMAP diet. And they often will use that for disorders of gut-brain interaction like IBS and other disorders. And it's an elimination diet, but it's not meant to stay that way. So what often happens is people start eliminating stuff. They find some relief, maybe usually about like 30%, something like that. And then they're like, okay, I guess I just can't eat all this stuff. And so then they can develop these secondary problems. At the most extreme of them is something called ARFID. So that's avoidant restrictive food intake disorder. And basically it's where they're scared to eat. It's basically they come in with a list of foods they can eat versus foods they won't eat. And so what a lot of parents don't know is that you're meant to reintroduce food once you do that initial elimination. So I think you can develop secondary anxiety around food. You can lose the idea that this is a at its core, it's a brain-gut problem. It's not a food problem. The reason FODMAP and other diets help is because the system is sensitized. And so what they're doing is removing any food that might cause, let's say, gas or something like that, which is fine, but that's not the core of the problem. Again, the problem is not the food, it is the nervous system.
I've actually looked into the FODMAP diet for a family member thinking it might be the cure for their stomach problems. So I know what this is. FODMAP stands for fermentable oligosaccharides, disaccharides, monosaccharides, and polyols. And you do not need to know that. What matters is that these are certain types of carbohydrates that can be hard for some people to digest. Foods high in FODMAPs are things like wheat, onions, garlic, beans, certain fruits like apples and pears. And when these foods are not absorbed well, they ferment in the gut and cause bloating, gas, and discomfort. So limiting these foods can help, but it's not a cure. And honestly, sometimes I think it makes people crazy. So speaking of crazy, this brings us to the treatment. Sorry to say that. It surprises everyone. The treatment that consistently helps many of these kids is clinical hypnosis. Clinical hypnosis is not mind control. It's not stage hypnosis. It's a way of teaching the brain and the gut to communicate better, calmer, quieter, and more predictably. I asked Dr. Navidi to explain why this works so well in kids and what it looks like in practice.
I've found over the years that kids respond much faster. Like I'll get my 1 session, 2 session, 3 session cures with kids versus adults. It's rare that happens, because I think by the time you're an adult and you have these problems, they're kind of more burnt into your nervous system. It's habituated, and people have developed beliefs around them that need time to change. So there's a kid I treated, I think she was 7 when I saw her. She had gone overseas with her mom and had gotten an infection. And it was really nasty, and it was so bad they had to kind of bring her home. And then she got treated and the infection was gone, but her stomach aches didn't go away. And that's a very common pattern, is when there's been some kind of trauma to the gut, the brain remembers and then is just hypervigilant and always scanning and in a sense, sending anxiety down into the gut. She came in and she'd been feeling kind of constant pain for about 3 months. I learned that she really liked fairies. And so we talked about the fairies. I learned about the fairy that she likes. And then we had her just use her imagination and really focus. Like, I got her attention and she really focused. And we just imagined that there was a fairy flying around in her stomach. And I think we created some sort of monster. There was a monster for the fairy and then wherever the monster had kind of done its work, the fairy would come in with its magic wand and just, tap, and the magic would spread and she could feel the tingling in her stomach. And after that, her pain was gone. Her brain previously was responding to that pain with fear and sadness. And by using those fairies, we changed that feeling to one of empowerment. She had something she could do. She felt good about it. It was fun. It made her smile. And that shifted the neurology.
Clinical hypnosis is also the treatment I found that works best for kids who are afraid to eat after a choking episode. I've seen cases like this so many times, when a child chokes once and then their brain decides that eating is not safe anymore, and now they won't swallow anything. So how can hypnosis help retrain that fear response so eating is safe again?
It's very similar. You want to understand how that's being maintained. Do they believe that they can't swallow versus are they just scared to swallow? Those are two different things. Then you want to understand, is this a broader issue? Are they anxious about a lot of different things? Or is this kind of a one-off thing? That's letting you know the kind of the severity of what you're dealing with. And then you want to understand, okay, how far along are we? What role are the parents playing? Are they how much are they accommodating? Are they really literally not eating anything? So you're doing kind of this assessment. And then you want to understand their strengths. Okay, what are they good at? What do they love to do? How can we reframe this in their mind from something where I'm just staying safe by not eating to maybe shifting it in a way that they're excited about eating? Can we link it to something that's important to them? So very treatable.
If someone you know has had one of these issues we talked about, was clinical hypnosis on your radar? Was it suggested? Therapy was probably suggested, but this is different. Okay, what about anti-anxiety medications like Prozac or Zoloft, one of the SSRIs? Those are often prescribed too, and in my experience, they are helpful.
I think, again, it helps. I'm going to assume mainly because it's going to lower anxiety in general. But I don't think it's fundamentally treating the problem. I think some percent will just get better from that reduction, but I think a lot won't. Because again, I think the problem is within that nervous system, the brain has mistakenly identified certain parts of the GI system as dangerous. And so it's scanning and catastrophizing in a really anxious way that then feeds back into the gut, causing more problems.
This has been my experience with patients also. Sometimes these meds just make the therapy easier for the patient, and they don't need the medication for very long. These issues sound really challenging to treat, and while the road to diagnosis can be frustrating, treatment goes pretty well.
As a psychologist, we see a lot of really tragic situations, long-standing problems, layers of trauma, depression. When it comes to all that stuff, treating someone with chronic functional abdominal pain or IBS or something like that is so pleasant. They respond quickly. The treatments are really empowering because they're not just learning to help their gut, but they're also just learning hypnosis skills that they can use to calm themselves down for the rest of their life. And I always love doing this work because you help someone with their stomach issue. And then if there's deeper issues to work on, they're so open to working on it because you've already helped them in such a big way.
Next, we'll get into how hypnosis is done. It's probably not what you expect. But first, if you've been listening and thinking, what can I do right now to support my child's gut? Let me tell you about a product I love for everyday digestive comfort. I've been recommending Begin Health Growing Up Prebiotics, a gentle daily prebiotic powder designed for kids ages 1 and up. It has 2 ingredients, a human milk oligosaccharide that's identical to what's found in breast milk, and chicory root fiber. These help feed the beneficial bacteria in your child's gut. What I love about this product is how easy it is to use. It's unflavored and dissolves completely, so you can mix it into water, milk, or any food, which is perfect for even the pickiest eaters. Most kids don't get enough fiber in their diet, and this gives them 3 grams per serving to help protect and nourish their gut microbiome. Begin Health's Growing Up Prebiotics are part of a gentle, long-term approach to gut health while you're working on other things like stress, routines, and the gut-brain connection. You'll find a link to Growing Up Prebiotics in the show notes. Support your child's digestion in a simple, kid-friendly way.
Eczema is unpredictable, but you can flare less with Ebglyss, a once-monthly treatment for moderate to severe eczema. After an initial 4-month or longer dosing phase, about 4 in 10 people taking Ebglyss achieved itch relief and clear or almost clear skin at 16 weeks, and most of those people maintain skin that's still more clear at 1 year with monthly dosing.
Ebglyss, lebrikizumab LBKZ, a 250 milligram per 2 milliliter injection, is a prescription medicine used to treat adults and children 12 years of age and older who weigh at least 88 pounds or 40 kilograms with moderate to severe eczema, also called atopic dermatitis, that is not well controlled with prescription therapies used on the skin or topicals, or who cannot use topical therapies. Ebglyss can be used with or without topical corticosteroids. Don't use if you're allergic to Ebglyss. Allergic reactions can occur that can be severe. Eye problems can occur. Tell your doctor if you have new or worsening eye problems. You should not receive a live vaccine when treated with Ebglyss. Before starting Ebglyss, tell your doctor if you have a parasitic infection.
Ask your doctor about Ebglyss and visit ebglyss.lilly.com or call 1-800-LILY-RX or 1-800-545-5979.
Hey, it's Brooklyn Adams, and I'm partnering with Abercrombie to tell you about the newest drop from their active brand, Your Personal Best. YPB leggings are made with buttery soft fabrics that hug you in all the right places and come in Abercrombie's viral Curve Love fit, designed to eliminate waist gap. Paired with sports bras and super soft sweatshirts, it's activewear that supports every part of my busy lifestyle and gives me my best butt ever. Head into the new year feeling your personal best. Shop Active by Abercrombie in the app, online, and in stores.
This episode is brought to you by State Farm. Checking off the boxes on your to-do list is a great feeling. And when it comes to checking off coverage, a State Farm agent can help you choose an option that's right for you. Whether you prefer talking in person, on the phone, or using the award-winning app, it's nice knowing you have help finding coverage that best fits your needs. Like a good neighbor, State Farm is there.
How does hypnosis work? What are we even talking about here?
Hypnosis, sadly, is one of the most misunderstood phenomena in the field of psychology. It's also one of the most studied. So it's this weird balance where we probably know more about hypnosis than many other things in psychology. Yet there's more misunderstanding. There's more junk out there about hypnosis than almost anything else in psychology. So both of those things are happening at the same time, right? So what is it exactly? If it's not all this, I'll categorize most of the stuff people know about hypnosis as entertainment hypnosis, right? So mind control, magic, the weird stuff we see on stage shows and all that stuff. So if you just go and say, okay, what is this thing? It is essentially teaching someone how to go into a state of trance, which is a state of consciousness that all humans go in and out of throughout their day. I go into it. I don't know you, but I know you go into trance too. Probably doing things you enjoy, probably when you're driving to a place you've been many times. Kids are going in and out of trance constantly. And if you've got teenagers, I had two, now I have one, now that he's 20. If you just hand them a phone, they're going to go into trance like immediately. So as humans, we're always going in and out of trance, especially kids. The trick of hypnosis is just teaching them how to do it deliberately rather than accidentally. So it's not actually very hard because we naturally go into trance. And really all that it requires is getting someone to focus their attention and use their imagination. You can just get those two things going over a period of time, people are going to go into trance. And why do we care about trance? We care about trance because in trance, we have a much better mind-body connection. We can use our imagination to influence our mind-body system in ways that we can't do in our normal state of consciousness. And the thing is, they don't know what trance is, but they might even be in trance when they're asking themselves that question. So trance isn't going to feel weird. It's usually going to feel pleasant. Even when we get lost in our work, and I'll give you a common example as parents, I'll be knocking out, I'll open my inbox and I'll have like way too many emails and I'll just be knocking them out and I'll be in the zone and then I'll get done and I'll be like, oh, my back is a little sore. I've been sitting weird, but I didn't feel any of that while I was in the zone, while I was in trance. We go into these states without really realizing we're doing it, but it's really a nice place to be.
We are talking about entering a state of enjoyment and relaxation. Do you guide a child? Is there a swinging watch involved?
Hypnosis looks different depending on the age of the child. So the younger the child, the more it just looks like playful imagination. The older the child, the more it starts looking like kind of standard hypnosis where they're closing their eyes, they're becoming very relaxed, they're turning their mind inward versus, a 6, 7, 8-year-old. They're not necessarily going to even close their eyes, and they might not even stay still. They might be kind of looking around. But as long as you have their attention and you can engage their imagination, it's going to work. The best way to do it is at first get somebody to help you. I almost think of myself as a coach when it comes to hypnosis because I'm not actually doing anything to the person, but I am guiding them and they can decide if they want to listen to my coaching or not. And that kind of, to me, takes away the whole mind control part right off the bat. We want to guide them and teach them how to go into trance reliably and then teach them how to do it themselves. And at that point, it becomes self-hypnosis. So then if they're so inclined, they can go back home and they can practice using it. And in fact, for many children, it becomes a tool they use for the rest of their life. I've had many patients come back to me years and years later and talk about how they still use self-hypnosis for their own purposes.
Dr. Navidi mentioned ARFID earlier, and that's a type of disordered eating. People with ARFID won't eat. I have a bunch of kids that are scared to eat for a number of reasons, and you just can't make them. It doesn't help. What do you do?
So maybe in therapy, we identified that their ARFID comes from a fear that their stomach's going to hurt if they eat. And we teach them this really nice way to change the way they're thinking and change the way they're feeling so that they're feeling calm and relaxed and they're viewing their stomach as healthy and strong. Let's say we develop this intervention in the therapy session. And then we teach them how to do it and have them practice. And so when they get to lunch, they can do whatever cue we taught them to kind of go into that state and then use the intervention that they learned.
What is an example of a cue?
My favorite cue, I use this one all the time, is just a left fist squeeze. And so a cue is anything that you associate. It's kind of like Pavlov's conditioning. If we associate the left fist with going into trance and we do it over and over and over again, what's eventually going to happen is they do their left fist, they just go into trance without even having to think about it.
Now I can think of a million issues that kids have that could be helped with this. What about the kids who you take to school and then they won't get out of the car or they cling to your leg and they won't go into school? School drop-off can be really tough.
Okay, so that would be a great place to play with hypnosis. So we might figure out, okay, what is it how are they imagining this situation in order to feel that fear? Because there's actually nothing dangerous happening in that situation. So it must be something they're imagining, right? And then once we understand what they're imagining, depending on the age of the kid, if they're older, we might do some good old-fashioned CBT, cognitive behavioral therapy, help them to evaluate those thoughts in various ways. But the nice thing about hypnosis is once they've evaluated the thoughts and they're like, yeah, gee, I guess people really don't care about me any more than I care about. I'm not watching them and they're probably not even watching me. Maybe they come to that realization, right? But then we can reinforce that using hypnosis by then having them imagine some positive, imagine how nice it's going to be to see their friend at the beginning of the day. And get them to focus on that instead by using hypnosis, using a cue to feel differently about the situation.
That was a very good answer. Okay. Here's a classic. Kid vomits and then is super scared they're going to vomit again and won't do anything that they think might make them vomit, like eat. There's actually a name for this. It's called emetophobia.
So emetophobia is a fun one. Out of all the phobias, for some reason, it forms really easily. maybe we're wired to find vomiting pretty disgusting. And so it's not hard for kids to develop it after vomiting. It's a scary situation. They feel out of control. It could potentially be very embarrassing depending on the context. And so then what happens often is they develop a secondary problem. They usually develop a functional abdominal pain or some sort of chronic nausea. Because what's happening is after they develop the phobia, they're very anxiously scanning their gut because they want to know, like, oh my God, is something wrong? I just ate. Is my stomach rejecting? Like they're always scanning. And then when they notice anything, the alarm bells go off in their brain. And that sends so much stress and anxiety into their stomach that actually causes more problems. If they've developed a secondary functional abdominal pain, we're going to use hypnosis to show them. And one of the things I use a lot with kids in hypnosis is the control room. It's a wonderful tool. You take them into trance. They go into this special room that they create where they can literally turn up and down their symptoms. And it's so empowering for a kid to be able to take this, let's say, nausea that they've been experiencing for months, that's been bullying them, and to be able to literally control it with a little dial and move it down whenever they want. So once you can teach them that, the pain or the secondary problem usually doesn't take very long. The emetophobia, those are stubborn phobias. And it takes a little while, usually. It's going to involve usually some CBT, some hypnosis, and then within CBT also exposure. So you usually want to start with their thinking. Usually they have very catastrophic thinking about the vomiting. Like, oh my gosh, I can't ever vomit. This is going to be the worst thing ever. And then you work on that. You work on techniques to calm them down, to calm their nervous system down. And then when they're ready, you get them to do some exposure, whether that's seeing images of throwing up or exposing themselves to like getting dizzy or something like that. But you want to try to find ways to expose them to these thoughts that they've been working so hard to avoid.
Also, an incredible answer. Now, this is like stump the GI psychologist, and I have one last question for him. Since we know kids are susceptible for developing these fears, what should a parent do if a child has a choking incident or vomiting to prevent a problem, especially if they have an anxious child?
The principle you want to focus on is the idea of safety and health. So the idea that, let's say they had a choking incident, right? You want to focus on the idea that, wow, like your body did exactly what it was supposed to do to save you. It reacted perfectly. It reacted so fast. It saved that piece of food from like going down into your lungs or whatever it was. Your body did such a great job and it's ready to handle anything like that it handles in the future. So you want to reference back to the health, the strength, the goodness of their body so that they can go back to trusting it again. Because a lot of these problems come after there's some, like I mentioned before, some kind of trauma, and they lose faith, they lose trust in their body. And once that happens, it becomes a very anxious situation that we want to get in front of. So there was an example, a kid that was getting a lot of stomach pain. It was clearly mind-body related, just you could see it from the symptoms. And they were really anxious. And they got checked out thoroughly by the gastroenterologist. After that was done, I told the mom, we need to emphasize how healthy and strong the doctor felt that your stomach was. Like, that's where physicians can really help with this stuff because you all carry a lot of authority. And the more that you can emphasize, wow, we looked at your stomach, we did this, it's looking so good, it's so strong, it's so healthy. And just doing that was like 80% solving the problem.
I'm going going to end there because Dr. Navidi basically said that his team can spend a few sessions working with your child, or I can just tell them they're fine, and 80% of the time, they're going to believe it. Problem solved. All right, I'm kidding. I wish it were that simple. Dr. Navidi's program is possibly the best resource I have come across in the past year, maybe longer. His team fills a need that just isn't anywhere else. They offer telehealth. Yes, they can do this work online. They have psychologists licensed in every state. They even have a parent education group and a group for parents dealing with kids who have encoparesis. I'm not going to describe what that is here, but let's just say if you're doing a lot of very dirty laundry, this might be what you're looking for. You can find the brilliant Dr. Navidi at gipsychology.com. I'll put the link in the show notes. Please share this resource with other parents. There just isn't a reason to struggle with disorders of gut-brain interaction when there's help. And go ahead and send this episode to a friend. This is great information for all of us to have. If you want to learn more about clinical hypnosis, I did an episode dedicated to it back in episode 43. It was called The Power of Hypnosis, Using the Mind to Heal. It's a good one. For more from the Pediatrician Next Door, find me on the web at pediatriciannextdoorpodcast.com. If you've got a question about the weird things kids do, send an email to hello@pediatriciannextdoorpodcast.com for a chance to hear your voice on the show. I'm Dr. Wendy Hunter, and I'm the Pediatrician Next Door. This show is produced by Red Rock Music. Make sure to subscribe and leave a review wherever it is you're listening. I'll be back next time with more.
As a 100% credit union-owned service organization, CU South understands your credit union's challenges and provides the tools you need to succeed. That's why we offer an all-in-one flexible core platform designed to elevate member experience, streamline your operations, and boost your net income. With CU South in your corner, you'll have everything you need to unlock your credit union's full potential. Head to cusouth.com to schedule a consultation or interactive demo.